everyone, welcome back to my channel. Welcome to his Pharmacology Difficult podcast. I'm your host Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find and if there's a question hovering in your minds, is pharmacology difficult? Lend your ears for a while and let in the magic of knowledge. So we are back with the year-end special series, and today's topic is so pretty interesting, pretty knowledgeable, and for every medical student. The topic is 10 things I wish every medical student knew about pharmacology. Yes, and you have to check whether you know these things or not. Let's begin without any delay. The first one. Pharmacology is not about memorizing. It is about understanding. Well, many people, and it's a common myth that just cram up all the drugs and you'll get through the subject pharmacology in flying colors. Well, I think you may get through the subject and your marks would be in flying colors, but what is the use of memorizing like that when you don't understand anything? Finally, when you have to use a subject for your benefit, for the patient's benefit, and for the societal benefit, you have to understand the basics and the core of the subject. You have to understand what is the mechanism of action, what is the interlinking between the different drugs, different systems, organ systems, what is the basics, what is the general pharmacology, everything you need to understand, you need to basically go through the whole thing. And then, it goes in a chain reaction. Mechanism, then effects, side effects, clinical use, contraindications, and then it loops back. And then it is interlinked to different organ systems. Next important point I wish every pharmacology or every medical student knew. Mechanisms are the heart of everything, Yes, that is the truth. Once you understand the mechanism of action, you can guess the uses, you can guess the applications, you can guess the clinical aspect of the whole drug therapy, and you can guess side effects. You can always understand the contraindications so very well once you know the mechanism of action. And everything gets into your mind permanently. It's not a short-lived cramming up process. It's a permanent, comprehensive process. Why the dose matters. Why the interactions happen, why the side effects occur. Everything is crystal clear once you know the mechanism. Third important point. Drug classes, they matter more than the individual drugs. Now, I know whenever the page of classification comes in front of every medical student, they try to first of all see the names of the individual drugs. And it's so easy once you focus on the drug classes rather than on the individual drugs that are enlisted below. You will understand that the endings, prazole, tidine, nevirapine, and all these kind of endings of the drugs, they are quite similar. And it's very easy to losartan, telmisartan, sartans, they are all belonging to a certain class of drugs. It's very easy to learn the drugs of a particular class. So focus on the class of the drugs. They have similar drug profile, pharmacokinetic profile, pharmacodynamic profile, similar mechanisms, similar kind of uses with the little differences. Definitely the potency may vary, the uses may vary, some of the drugs may become obsolete like cimetidine, etc. But focus on the classes and your learning life will become so easy. I promise you that. Next important point, pharmacology is the most important clinically useful subject. That is the basics of everything. Yes, that is the truth. No matter any branch you take, you become a dermatologist, you become a cardiologist, you become anesthesiologist. Any branch, if your pharmacology basics are strong enough, you can really empower your knowledge and apply it to the right manner, to the right degree, at the right time, and in the right perfect mannerism for the patient. It will not only benefit you, it will take your knowledge and your clinical status up to the next level, but it will also benefit the society and the patient. And that is what is important. You can take up any branch, ophthalmology, psychiatry. You can only justify everything and go for rational drug use, rational drug prescribing once your pharmacology knowledge is very sound. And you have to use pharmacology daily. If you become on the clinical side, you become a doctor serving patients, you have to use pharmacology daily. So don't cram it up. Go for comprehensive approach. Understand everything. Next important point, I wish every medical student knew. Side effects tell you more than what you think or what you can imagine. Yes, side effects or adverse effects are not a thing to cram up only. They are not random memory points. They are logical extensions of the mechanisms. And if the mechanism activates the sympathetic system, guess the side effect? Tachycardia. If the mechanism blocks dopamine, guess the side effect? Extrapyramidal symptoms. And like this, you can guess all the side effects of the knowledge of the mechanisms can really make you understand the side effects very, very well. And they're very important. They're very, very important. It's a total different special aspect of pharmacology, pharmacovigilance concerned with the ADRs. And it's a broad thing, broad aspect of pharmacology. So just don't take them so easily. Don't cram them up. Try to understand. Next important point. Drug charts are your best friends. I'm not talking about drug classification. I'm talking about drug charts. Drug charts can be your handmade charts, can be the digitally made charts. Nowadays, technology is so advanced, you can make them digitally by using apps like Paint, Draw, Canva, all these kind of things. Handmade flow charts can help you. If you have created diary while studying the theory book, then you can actually make the flow charts along with you understand. Drug charts can be of many types. Drug classes, drug mechanisms, then drug side effect patterns, and last but not the least, prototypes. So you can make ample amount of charts for one particular topic and make a diary of all the charts. And when you revise in the end, you don't have to go through the theory book again. Just go through your flow charts, your handmade charts. Just go through the PDFs of the digitally made charts and everything will be on your tips. It's so easy. Next important point. Pharmacology changes every year. So what is the moral of the story? Why am I telling you that? You also know that. But the moral of the story is you have to stay updated. Yes. It changes so often and so randomly. And so quickly it is changing at a fast pace that so many drugs are becoming obsolete. The therapies are outridden. You have to stay updated all the time, every day, every week, every month. Follow the FDA, US FDA updates about the drugs, WHO, essential medicines, pharmacology newsletters. By the way, you can subscribe to my newsletter, which is the sponsor of today's video or podcast, Pharmacology Further e-newsletter, and you can stay updated every time. And there's an ample amount of knowledge and wonderful things for you in my newsletter. And then one more way to stay updated is to go through the journals, latest research, and stay updated. You'll stay ahead 90% of students. No pains, no gains. So take the pains and enjoy the subject. Next important point, rational prescribing is more important than mugging up the facts. Mugging up, you understand? Just going through the facts, keeping them in your mind. And when you're asked certain here and there, you don't know anything. You just mugged up the facts, just crammed them up. In real life, I tell you, nobody will ask you the half-life of metoprolol. But what they will ask you? should I give this drug to the patient? And your background knowledge should be of the half-life, of the pharmacokinetics, of the pharmacodynamics, and rational drug prescribing is truly a skill that you have to master as being a doctor. So, if you call yourself a student of medicine, a medical student, a doctor, master the art of rational drug prescribing, and truly, that's not only mugging up the facts, but keeping your sound knowledge, background knowledge really strong enough so that it hits hard in the front, right? Next important point. Don't be afraid of the adverse drug reactions. I know it's one big aspect of the pharmacology, pharmacovigilance, and people fear it a lot, but don't be afraid of them. Actually, you can predict them, and that is the truth. When you know the mechanism, when you know the organ systems which are involved, you can wonderfully, easily predict the adverse drug reactions for that particular drug. It is not a guesswork. It's actually logic. And last but not the least, every medical student should know this point. The learning, the knowledge, and the skill of pharmacology can actually transform you into a better doctor. When you understand and you are engaged and you find the subject pharmacology too interesting, you can prescribe safely, you can choose wisely the therapy, the drug, you can educate your patients in a much better way. In a layman language, if you are able to understand, you can educate also. And you can avoid the dangerous interactions. Even the food-drug interactions you can avoid when your knowledge is enough vast. So this one subject, remember and mark my words, this one subject can actually boost and elevate your clinical confidence up to the next level, up to the 9th cloud. And once you really understand the skill and try to practice it clinically, you will feel the same way, that your confidence level is up to the next level on the 9th cloud. So, these were the 10 things I wish every medical student knew about the subject pharmacology. And once you understand these principles, the subject learning life becomes so easy, your pharmacological life becomes so easy and very enjoyable. You start understanding the subject, you start applying the subject, you start enjoying the subject. So, tell me in the comments which particular point you like the most. If you like this video, don't forget to hit the like button. Don't forget to subscribe to my channel, share the video, and stay tuned for more such interesting, wonderful topics, the year-end special series. Till the next time, thank you, take care, bye-bye.